Hello, my name is Brady Kirkman, Executive Director of Marketing and Business Development here at Wound Hyperbaric Health, and thank you for joining us today with The Pulse. And I have with us Naomi Bach. Hello, Naomi. How are you?
Hey, I'm well.
Fabulous. Tell us a little bit about your role here at Wound Hyperbaric Health.
Sure. So I'm a nurse practitioner, and I specialize in wound care, and then I'm also the clinical program director for the wound clinic.
Excellent. Okay, well, tell us a little bit about wound care services that are offered here.
Sure. So we offer a couple of different things. We offer wound care, obviously, and then we also do ostomy care, and the third branch of that is hyperbaric medicine.
Okay. How are we different from other facilities that may have similar services?
Sure. So I think we do a really good job of partnering with a lot of the different specialists in the area, as well as every healthcare system. So we're under the program of Healogics, and we are partnered with Sanford, obviously, as Wyndham. But that doesn't limit us from partnering with Dakota Vascular, with anything with Avera, with Allina, Mayo, any of those other systems. So we do maintain a lot of relationships so that patients can stay with their own providers in addition to the care that we offer here.
And you talked about ostomy care. Tell us a little bit about what that is.
Sure. So patients who have had bowel disease or cancer or can be a number of things and end up undergoing surgery and then have an external fecal or urinary diversion and then wear a pouch either permanently or for a period of time. And so we work with them pre-op to do some teaching. Obviously, it's a big life change. So we want to make sure that they have as much information going into surgery as they can. And then also post-op as they adjust back to life with the ostomy. And then ongoing, making sure that they have a pouch that's fitting correctly.
Okay. Well, and we don't just cover Wyndham, from my understanding. We have a pretty broad area. Tell us a little bit about our distance that we travel, or not travel, but people come to us.
Sure. So we have about a 60-mile radius of patients who see us regularly, and that's really the area that we cover for marketing and where we try and maintain most of our relationships. But we go up to 90 miles. We do get a lot of patients coming out of Sioux Falls after surgery or after, anything that's happened that they would be hospitalized for. And then we also see from Mankato and New Ulm area as well.
Okay. Well, you talked about your wound care. We also have another service line that is going to be joining us probably back here in the next couple of months. Talk to us a little bit about that.
Yep. So we have HBO coming back, and that's not the movie channel. So it's hyperbaric medicine. And basically, it's chambers, and we have what's called a monoplace chamber here. So each patient has their own chamber. You're not in a room with anyone else. And what it does is it drives oxygen into the tissues under pressure. So think of it as kind of like a giant pop can. And what that does is it helps to bring oxygen to places where normally it's not being delivered, either due to radiation or due to a wound, due to vascular disease. And so we're able to treat some especially like post-radiation injuries or cystitis, some things like that, just to really try and get oxygen and healing back to those tissues that there's really no other way to accomplish that.
And when do you anticipate maybe those being back?
We're hoping late February.
Okay.
So just depends on the weather and on construction and all the things.
And that's correct. So they were kind of temporarily taken away because of the construction of the new building, correct?
Correct. Yep. We found that we needed to reconstruct that area as well as the medical office building.
So it'd be nice to kind of have that newer addition upon, reopening as well.
Absolutely. Yeah. And look for, we'll definitely advertise for some tours with that. So we definitely want the public to come and join us for that.
And if they want to get a hold of you, how can patients reach you?
Sure. Our number is 507-831-0686.
That is great. Well, Naomi, I really appreciate you taking the time to talk a little bit about the services that you provide and joining us here on The Pulse, and we'll see you next time.
Awesome.